Today we are going to talk about ovarian cancer. The reason I wanted to make a video on ovarian cancer is because there's often a confusion about ovarian cancer versus cervical cancer. Yes, both are gynecological cancer types, however, both are originated by different tissues of the reproductive organ. I've also made a schematic drawing of the reproductive organ so that you can understand where cervix is located and where ovaries are located. Also, if you have noticed, on our episode number 7, we have discussed the early detection methods for endometrial cancer and cervical cancer. The reason why we have not made a video on ovarian cancer is because, as of yet, there is no such early detection method for ovarian cancer. Unfortunately, by the time ovarian cancer is detected, it is often at the late stage. Therefore, many researchers want to develop an early detection method for ovarian cancer. So let's go ahead and see what the specifics of ovarian cancer are. So as you can see in the schematic, cervix is the narrow lower part of the uterus where it connects to the upper part of the vagina. And the ovaries are reproductive organs on each side of the uterus in the lower abdomen. So now let's talk about ovarian cancer facts. It is the 5th most common cancer type in the US. And the factors that increases the risk of ovarian cancer is for women that do not give any birth, or the first birth occurs after the age of 35. And the factors that lowers the risk of ovarian cancer are childbirth at age 25 or younger, or use oral contraceptives. It has been also found that 5 to 10% of all ovarian cancers are familial. It has also been detected that there's 3 hereditary patterns, such as ovarian cancer alone, ovarian cancer plus breast cancer, or ovarian cancer plus colon cancer. And when I tell you about the genetic reasons for ovarian cancer, I think you might understand why there's a correlation between breast cancers as well. Because the genetic causes of ovarian cancer are gene mutations in the genes called BRCA1 and BRCA2. So both gene mutations are inherited defects in genes that are necessary for cell repair. BRCA2 gene mutation has an improved survival outcome than it has with BRCA1 mutation. And the reason why I'm saying that, you might understand why the correlation is between breast cancer, because if you follow us on Facebook or LinkedIn or Google+, we are also posting there the news of certain types of cancer, and I'll be writing also a little blog on that as well. So the recent mastectomy of Angelina Jolie was because she has been detected that she has the BRCA1 and 2 gene mutation, which is one of the main causes of breast cancer. So now you can see the correlation between breast cancer and colon cancer as well. So let's talk about the symptoms of ovarian cancer. And as I mentioned in the beginning, when ovarian cancer is detected, unfortunately, is already at the late stage. So now let's talk about the late stage symptoms of ovarian cancer. Abnormal vaginal bleeding or discharge. So as I also mentioned before, ovarian cancer and cervical cancer often be confused with each other. One of the reasons for that is also the symptoms are often similar. And this is one of the symptoms that is also true for cervical cancer. Pain or bleeding during sexual intercourse. This is also one of the symptoms that is also similar with cervical cancer. So other ovarian cancer symptoms are pelvic or lower back pain, bloating or intestinal gas, enlargement of the belly, ascites, difficulty eating or feeling full quickly, loss of appetite or weight loss, fatigue, change in urinary urgency or frequency, and change in bowel habits constipation, or diarrhea. So now let's talk about the diagnosis for ovarian cancer. Usually it starts with a physical exam, such as pelvic exam, then an ultrasound, and often the doctor orders a CT scan, an MRI, CA-125 serum test, a barium enema X-rays, and colonoscopy can also be ordered to check if there's metastases to the intestines or rectum. And sometimes a chest X-ray can also be ordered to see if there is a metastasis to the lungs. As I mentioned also in the beginning, unfortunately, so far, the only way to detect ovarian cancer is through biopsy. Now let's talk about ovarian cancer stages. As any cancer type, ovarian cancer has also stages from 1 to 4. However, some cancer types has also subcategories. For example, such as in ovarian cancer, the stage 1, in which tumor is limited to the ovary, has a stage 1A, and that is one ovary is involved, no ascites, and intact capsule. At stage 1B, both ovaries are involved, no ascites, intact capsule. At stage 1C, both ovaries are involved, malignant ascites and capsular involvement. At stage 2, tumor extends beyond ovary into the pelvis. At stage 2A, pelvic extension to uterus or fallopian tubes. At stage 2B, pelvic extension to other pelvic organs such as bladder, rectum, and vagina. At stage 2C, pelvic extension plus IC findings. And IC means interstitial cystitis, and that means a clinical syndrome that is characterized by daytime and nighttime urinary frequency, urgency, and pelvic pain. At stage 3, extrapelvic extension or positive lymph nodes. At stage 3A, microscopic seedings outside of the pelvis. At stage 3B, the tumor is 2 centimeters or less. At stage 3C, the tumor has reached a size of more than 2 centimeters and lymph nodes are involved at this stage. And at stage 4, as many other cancer types, this is the metastatic stage, also as stage 3 where the lymph nodes are involved, and stage 4 it's usually a metastatic stage where the distant organs are involved, as so is here in this case, and that is at stage 4, distant extraperitoneal organ involved such as liver and pleura. So let's talk about the treatment for ovarian cancer. There are 2 different types of treatments for the early stage and the late stage of ovarian cancer. For the early stage, that is the staging from 1A and 1B, involves in almost all cases surgery. And we call that TAH, BSO, which means total abdominal hysterectomy, which means the removal of the uterus, bilateral salpingo-oophorectomy, which means the removal of ovaries and fallopian tubes. At late stage of ovarian cancer, which involves from stage 2 to stage 4, chemotherapy is the treatment method, which also involves the partial removal of the tumor following by a platinum treatment such as cisplatin, paclitaxel, carboplatin, docetaxel, and cyclophosphamide. Chemotherapy is also ordered for recurrent ovarian cancer cases, and that is ifosfamide, etoposide, liposomal doxorubicin, gemcitabine, topotecan, oxaliplatin, 5-FU, or ultratamine. And radiation therapy is only ordered in recurrent ovarian cancer cases. So I hope this was helpful to you. Thank you so much for watching. And if you like this video, then please share them with others. We really want everyone to know about ovarian cancer and the difference between ovarian cancer and cervical cancer. So again, thank you so much for watching, and I see you in the next episode. Until then, take care.